All right, everyone, welcome back. We're ready to jump into another deep dive.
Absolutely looking forward to it.
Today, we're tackling diabetic neuropathy, a topic that we know a lot of you are dealing with, or maybe know someone who is.
Right. It's certainly a common complication.
So let's unpack this. For anyone who's just tuning in or needs a refresher, what exactly is diabetic neuropathy?
Well, in the simplest terms, diabetic neuropathy happens when high blood sugar levels start to damage your nerves.
Okay, damage to the nerves. So how does that happen? What's going on in the body?
Think of it this way. You know how electrical wires have a protective coating?
Yeah, like an insulator.
Exactly. And it keeps the electricity flowing smoothly, right?
Oh,
Well, nerves are kind of like those wires transmitting signals throughout your body.
makes sense.
But when blood sugar is consistently high, it's like that coating on the wires gets all gummy and messed up.
Ah, so the signals can't get through properly.
Precisely. And over time, those wires, your nerves, can get damaged. And that damage is what we call neuropathy.
So it's not just a one-time thing, it's the prolonged exposure to high blood sugar that's really the problem.
Exactly. And this damage can happen anywhere in the body, but we see it most often in the hands, feet, and legs.
Okay, that makes sense. Those are kind of the extremities.
Right.
So when we talk about diabetic neuropathy, are we talking about just one thing, or are there different types?
Good question. There are actually several types. We can break them down into three main categories: peripheral, autonomic, and focal neuropathy.
Okay, three big
Oh,
ones. Let's start with peripheral neuropathy.
sounds good. Peripheral neuropathy, it's kind of in the name, right? It affects the peripheral nerves, those in the hands and feet.
So someone with peripheral neuropathy, what might they be experiencing? What are the symptoms?
Well, it can start really subtly, maybe some numbness, a tingling feeling, that pins and needles sensation. Some people describe it as a burning sensation.
Oof, I can imagine that's uncomfortable.
Definitely. And as it progresses, it can lead to more severe pain, even muscle weakness.
And I imagine a loss of sensation, like you were saying, could be really dangerous, especially in the feet.
You're absolutely right. If you can't feel a cut or a sore on your foot, it can easily get infected. That's why regular foot care is so crucial for anyone with diabetes.
Right. Got to catch those things early.
Mm.
Okay, so we talked about peripheral neuropathy. What about autonomic neuropathy? What does that affect?
Autonomic neuropathy is a bit different. This one targets the nerves that control your internal organs, the stuff you don't usually think about.
Like what? Give us some examples.
Well, think about your digestion, your heart rate, your blood pressure, even bladder function. All of that is controlled by your autonomic nervous system.
Wow, so a lot of really important stuff.
Absolutely. And when these nerves are damaged, it can lead to a whole host of problems.
So someone with autonomic neuropathy, what kind of issues might they face?
It can really vary from person to person. Some people might experience digestive issues like slow stomach emptying or constipation.
That sounds really unpleasant.
It can be. Others might have dizziness when they stand up because their blood pressure isn't regulating properly.
That makes sense.
And some people even struggle with bladder control.
Wow, this is serious stuff.
Hmm.
Okay, so we've covered peripheral and autonomic. What about that third type, focal neuropathy?
Right, so focal neuropathy is kind of interesting because it tends to target specific nerves instead of a wider area.
Interesting. So where does this usually show up?
We often see it in the head, torso, or legs.
Okay, and what kind of symptoms would someone experience with focal neuropathy?
Well, it really depends on the nerve that's affected. You might have double vision if a nerve in your eye is involved, or maybe pain in your chest or abdomen. Sometimes it causes weakness in a single muscle.
So this is the one that's really kind of all over the place.
Pretty much.
Okay, so we've got these different types of neuropathy, all stemming from high blood sugar. What are the biggest risk factors besides having diabetes?
Well, like we said, high blood sugar is the main culprit. And the longer someone has diabetes, the more likely they are to develop neuropathy.
Makes sense. It's like anything. The longer you're exposed to something harmful, the greater the risk.
Exactly. But there are other things that can increase your risk, like high blood pressure and high cholesterol.
Oh, right. Those are big ones for overall health anyway.
Absolutely. These conditions damage your blood vessels, which in turn can affect the nerves they supply.
It's all connected, isn't it?
It really is. And of course, smoking is never a good idea. It restricts blood flow and further increases the risk of nerve damage.
Okay, so it's like a perfect storm of factors that can contribute to this.
Yeah, you could say that.
So all this talk about neuropathy is making me a little nervous. What can people do to prevent it, or at least slow it down?
The most important thing, hands down, is keeping your blood sugar under control. That means sticking to your medication plan if you have one, making healthy choices when it comes to food, and getting regular exercise.
So it's really about taking care of your overall health. That's good advice for everyone, really.
Absolutely. But specifically for diabetic neuropathy, regular foot care is non-negotiable.
Okay, you've mentioned foot care a few times. Tell us more about what that entails.
It's simple, but so many people skip it. You need to be checking your feet every single day. Look for cuts, sores, blisters, anything that looks unusual.
And I bet wearing the right shoes is important too, right?
Absolutely. Make sure your shoes fit well and aren't too tight. You don't want anything rubbing or constricting your feet.
Right, because you might not feel it if you have neuropathy.
Exactly. And those seemingly small sores can turn into big problems if they get infected.
So prevention is key. But what if someone is already experiencing symptoms of neuropathy? What are their options?
The goal of treatment is really threefold. We want to manage the pain, prevent further nerve damage, and improve the person's quality of life.
Okay, that makes sense. And how do you go about doing that?
Well, there are a number of different approaches. Medications can be really effective for pain relief.
So are we talking about just masking the pain or actually addressing the underlying problem?
It can be both, actually. Some medications work directly on the nerves to reduce pain signals, while others might address underlying conditions like depression, which can make pain feel worse.
Ah, so it's not just about the physical sensation of pain, but also how it affects your mental state.
Right, it's all connected. And then there's physical therapy, which can help improve strength, balance, and coordination.
So people can maintain their mobility and independence, even with neuropathy.
Exactly.
And what about lifestyle changes? Do they have a role in managing neuropathy?
They absolutely do. We've already talked about the importance of quitting smoking. Maintaining a healthy weight through diet and exercise is crucial too.
Not only for managing blood sugar, but for overall health.
Exactly.
So it sounds like taking a multifaceted approach is really the best way to manage diabetic neuropathy.
I would agree with that.
Well, this has been incredibly informative. Thank you so much for breaking all of this down for us.
It's been my pleasure.
And for our listeners out there, remember, diabetic neuropathy is a serious complication, but it's not inevitable. By managing your blood sugar, taking care of your feet, and seeking treatment early, you can significantly reduce your risk and live a full and active life.
I completely agree.
And even if you don't have diabetes, understanding the impact of neuropathy really highlights how important it is to take care of your overall health. So keep learning, keep exploring, and if you have any concerns, talk to your healthcare provider. Until next time.